Hi, everyone. Welcome. My name is Lindsay Brown from the Beyond Clean team, and I would like to welcome you to the first installation of our Talking Dirty series. During this installation, we are going to be focusing on a concept called microcredentials and what that means for the sterile processing space. Every sterile processing professional knows that learning is a huge part of the job, not only in preparation for entering the field in some cases, but during those initial weeks and months of orientation. But it doesn't end there. You continue to engage with the industry, you continue to engage with the processes in your department, and essentially entering the healthcare industry is entering into a field of lifelong learning. Learning has no end. We learn to do the right things, we learn to do the wrong things, and we learn over time where we can seek out reputable, trustworthy information and how we can approach professional development in new, innovative, and disruptive ways. Today, we're going to be talking about sterile processing education and a brand new learning opportunity for this field called microcredentials. And joining me for this discussion is Dr. Jim Stobinski, Chief Executive Officer at the Competency and Credentialing Institute, and Lisa McKown, Manager of Research and Development for Beyond Clean. And as we prepare to get into it about microcredentials and about extended learning, continued learning in the sterile processing field, Jim, I would love it. First of all, welcome to both of you. I'm so glad to have you on today. And Jim, I'd love it if you would give us an overview of CCI and kind of what CCI is all about.
Thank you, Lindsay, and great to be here. We are a long-term partner with Beyond Clean. And so CCI is a nonprofit based in Denver, and we do credentialing for now mainly for nurses that work in a perioperative setting. Credentialing for a long time has been thought of as certifications. We are expanding the notion of what credentials are, what credentialing bodies do, and that brings us to this partnership with Beyond Clean and the topic of microcredentials. Today, you probably know us if you've heard of the CNOR credential. We have been doing certification work since 1979, and we have a variety of certifications, but now increasingly things like certificates of mastery and microcredentials. And today we're going to talk about microcredentials for a diversity of healthcare professions, multidisciplinary learning, and our partnership with Beyond Clean.
Yes, and Jim, I'm excited that you used the word microcredential multiple times because something that I want the viewers of this Talking Dirty session to get out of this conversation is what exactly a microcredential is. Can you shed some light on what a microcredential is and what it does?
I can, but the other thing, I think what we should say very early on is this whole thing about a microcredential is not currently well defined. So an opportunity for Beyond Clean and for CCI in working together, number one, we can reach a multidisciplinary audience. And I think the value of having sterile processing professionals, nurses, surgical techs learning together, I think it brings great value to the work we do in the operating room. Number one. Number two is in combining our resources, I think we can set a high standard. The difficulty right now with microcredentials is there's not a well-accepted definition. So when CCI started this, we went to the academic literature, and there were a couple of key points. Microcredentials, so instead of a set definition, we established some key points, which are these. Number one, and I have to go to my notes to make sure I get this right, that they should be competency based, and they should assess skills and knowledge. There should be some sort of framework in some respectable organization needs to help establish standards. In a field where things aren't very clear, somebody putting something out and saying, we're going to begin with this standard is important, and CCI is willing to do that. That we should have recognized subject matter experts be part of this. So a connection to Beyond Clean and all the people there, natural, that works. And they should be meaningful and of high quality. And so to meet all of those, we've set up a framework. Before we began our work with Beyond Clean, we'd already done some of these. And one of the things that we established very early is that they should have a basis in a profession. And so to do that, micro-credentials are discrete bits of knowledge, generally a smaller part of a recognized larger body of knowledge. And for us in our work with Beyond Clean, these are roles, jobs that are done and defined by something like a role delineation study or job analysis, which is done for certification credentialing. And then we take a segment of that and we concentrate our work there. I think Lisa is going to give us some examples here in a minute, but for us, where we started, we have a credential called CSSM for management, nurses that do management in the operating room. We took one part of that, one segment in strategic management, and we built our first micro-credential and set the framework. And then, so for the future, smaller bits of knowledge, things that can keep you current in your profession, but it's part of a larger recognized body of knowledge. So that's kind of the rough framework, kind of the guidelines. But I will emphasize it is not a well-defined field. And the other thing that we should keep in mind, they're unlike certifications. So for the certifications that people do in central processing, there are accreditation standards. And with groups like ABS&C and NCCA, there are no comparable standards right now for micro-credentials. So bringing together two quality organizations like Beyond Clean and CCI, we have the chance to kind of set the benchmark for future work. And that's a very exciting part about coming together to do this.
Wonderful. I agree. It is a very exciting part of it. And Jim, just to provide a summary, to break it down a little bit more, very generic terms, essentially what a micro-credential does is it takes one specific niche area of learning associated with your job role, and it essentially creates a course around that specific area. And so I think you're right in saying that the the world of micro-credentials is largely undefined. Because when I think micro-credentials, I think of like the technology industry, and I think of other industry that offers that really detailed, drilled down learning on very specific areas. And I don't see that a lot in the healthcare field. Maybe I'm not looking in the right places, but now that we're is that not the case?
Lindsay, you are spot on. This is not yet widely done in healthcare, but it is very widely done in IT and tech. And there are a lot of players in this field. In IT, a lot of it is done by for-profits. So if you want to train in a certain software offered by a company, they offer micro-credential in there. In industry is very closely tied. In certification, there are certification bodies that do this. Academic institutions, there are some that are into this in a big way, like the State University of New York. They have a lot out there in this field. You are correct. It's a discrete body of knowledge, and we offer a learning experience that encompasses knowledge, skills, and aptitude are all encompassed. That's the basis for the work that we're doing with Beyond Clean. We actually help you to work and develop your competency in a given field in addressing knowledge, skills, and attitude.
And I want to get into sort of the importance behind the multidisciplinary or interdisciplinary approach in a little bit. But right now, I would love to hear from you, Lisa. You have done such incredible work in the areas of research for the sterile processing field in general for many, many years. And having you at the helm of creating a sterile processing microcredential makes so much sense from not only a quality standpoint, but just from the standpoint of you've done the work to understand every aspect of the industry, from generalized processes to finite granular level reprocessing steps. So in your eyes, what do you see as the value of a sterile processing microcredential based on what Jim said, kind of what it does, what it is? What's the value that it can bring to this specific industry?
I believe that the value is in creating specialization and providing specific marketable skills that the industry really needs. And one of those things is really building on the critical thinking aspect of competency-based education.
And I completely agree with you. Something that is very striking to me is the idea that learning once you get a certification, for example, once you're certified, obviously you have to get specific continuing education credits to maintain that certification. And the sterile processing industry by and large has mostly been focused on continuing education credits as the means by which you learn. So if there's not a CE attached to it, then it's not worth your time. And I think it's such an interesting conversation to have with people because you can tie a CE credit to a presentation that doesn't encourage that critical thinking that you were just mentioning. It doesn't necessarily speak to your overall competency in a specific area. And so when we compare and contrast the two, because with a microcredential, there are no CEs that need to be gathered to maintain that skill. There's not necessarily like follow-up actions to it. So speak to the microcredential from the perspective of, okay, if I take this course, I can check it off my list and move on. Is that a mindset that you see, or what's the shift that a microcredential learning opportunity really generates inside of a professional?
Yes, so you're moving away from the checking the box on just attending a seminar, right? And you're building a portfolio of marketable skills. So that's the difference. You can showcase what you have accomplished and that you have specialized competence in these specific areas.
Wonderful. This micro credential that we are working on in collaboration with CCI is specific to cross contamination, and the thought process behind starting with that specific micro credential is that it really is interdisciplinary by nature, because cross contamination can happen throughout the healthcare facility, and whether it's environmental services, whether it's in the operating room, whether it's in sterile processing, whether it's in your ambulatory surgery center settings. Cross contamination is a huge hot topic and a big risk. And so, Lisa, if you can provide us with just an overview of what it was like building out the material for this micro-credential, building the learning activities, and really what you wanted to get to the heart at through those activities, I think that would be really, really nice.
Okay. So first of all, I am a very visual learner. And so for me, I have to be able to see the big picture first. And then after, associating patterns in a conceptual framework, I focus then on building the conceptual model and then diving deep into the details to extract insightful and thought-provoking questions or ideas. So my main focus is to ensure that the learners are challenged to enhance their critical thinking skills, but I think like an engineer And so tying the relationships and the context to pull out the meaning in the concepts, as a curriculum and content developer, I wanted to create a visual model that helped me to construct in the construction phase. So I use strategies almost like a coding process to associate these themes and categorize the topics and then correlate them into that framework, so that I could help facilitate the learning experience of the student's journey. And specifically with cross-contamination, people hear these ideas that, they should wash their hands. They hear that all the time. But then, and they know that when they go into the decontamination room, for example, that they're presented with risk. But how do they tie the ideas together, and how do they really apply these microbiology concepts and so forth in a real work setting in their day-to-day life? So what I wanted to do is I used Kolb's experiential learning cycle and Bloom's taxonomy to develop higher order thinking and skills. And then I wanted to kind of utilize these models and these frameworks by facilitating the learner to work through elements of thought. So basically challenging their current perceptions, and then so that's what helped me to build the learning statement and the learning objectives for the overall course, and then to take all of the individual elements, such as equipping learners with foundational knowledge and key concepts of microbiology. So my thought process there is for them, if they understand how basics of microbiology works, then they'll understand better how to make decisions in their day-to-day work. Then connecting the emotional intelligence with the purpose in their role. So this is then understanding how to analyze their, taking personal ownership in their role to improve infection prevention work practices and advocating for patient safety by putting themselves essentially in the shoes of the patient. We're in sterile processing, we work behind the scenes. So while we understand that every single instrument represents a person, sometimes in the rush of the day, we tend to, we're not patient facing. So we tend to forget that. So then if we hear a patient's experience and we understand how infections really impact people, then, it helps us to keep these things top of mind.
Yeah, Lisa. Okay, so first and foremost, if anyone watching this was wondering why Lisa McKown was chosen for the for the creation of this content, now you know. Like, Lisa, your ability to connect concepts and your ability to see the high level structure and then drill it down to a granular level and really understand the implications of that emotional learning and of understanding microbiology, in that how that concept applies to different settings when it comes to cross-contamination. I think that interconnectedness is huge. And that's a really big it's a really big piece to why we started with this particular topic too. I love your engineer brain. And I think that it's perfect for building out something like this, because we talk about this like it's almost like a mini college course. Like, it takes the idea, one concept of sterile processing, or one concept of decontamination, which is cross-contamination. That concept can apply in many settings, but it takes that very narrow niche concept and it builds out an entire framework of learning around that concept. And what that does is it allows you to understand it in a way that you can then apply what you learn to the different settings throughout your job and the different processes that you move through, almost almost without thinking, they're almost second nature. But it challenges you and it encourages you to take a step back and think, oh, wow, I now understand why doing it this way will have XYZ implications. And I think that that's just such a valuable opportunity for learning and something that's currently missing in the sterile processing industry. Um, Jim, what I would love to do is I would love to hear from you. So, the relationship between the operating room and sterile processing is one that has many nuances. So when we talk about primary nursing, when we talk about a primarily nursing centric organization offering a sterile processing microcredential, tell me about the relationship there and why it's important. I'm going to, this is a very leading question, but why it's important to have that multidisciplinary or interdisciplinary approach to education.
So the first point, all of our credentials, whether in sterile processing, the operating room, all of these credentials are based on a job analysis. So we actually define the role. Sterilization is part of all of the work of all the nurses that work in surgery. However, we have gone from when I began my training, which is now getting on to 4 decades, we used to have training in sterile processing. We used to actually go work there. If you were caught up in your cases, you would go down and work in sterile processing, process instruments, wrap them, the whole thing. Nurses seldom do that anymore. That I would say is a deficiency for nursing. Even though we're the ones that use and touch the instruments and assemble them and use them to do surgery, we're not nearly as familiar as we used to be with sterilization. For the best outcomes for our patients, it would be a good idea if we were better at that. The real knowledge and the proficiency is with sterile processing professionals. So if we want to know how to do surgery better and have a greater understanding, we would talk to surgeons, nurses. If nurses want to know more about how does sterilization happen so that they have a better understanding and they get better patient care, they should talk to sterile processing professionals. It's their expertise. So, any activities that we can do that bring us together so we can learn together and benefit from our mutual expertise, that would be beneficial. If your outlook is, what can I do to get the best outcomes for my patients? You would collaborate with other healthcare professionals and benefit from their knowledge. What I see in this arrangement, CCI has experience in learning management systems. Beyond Clean has the subject matter experts and the expertise in sterilization, decon, all of those things, bringing them together for the mutual benefit of the professions that work in the operating room is a great thing. That's where I think the benefit is. This will be a mind shift for perioperative nurses that they're going to work with other professions. It will be an adjustment. The other thing that I will tell you, Lindsay, that where perioperative nurses really benefited from our partnership, we acknowledge that it is not easy to get good quality content in this area. And we ask nurses, of all the stuff you have to learn to take our exams, what areas really concern you? 2 of them always float to the top: sterile processing and emergency situations. So I'm not going to ask you to work with us on how to do codes. However, I would like to benefit from your expertise on sterile processing, sterilization. That's where I think we could benefit.
Excellent. Yes, the mutual benefits abound. That's certainly true. And the benefits for the sterile processing industry at large and the nursing industry, because this cross-contamination microcredential, even though it's coming from the learning management system at CCI, it's available to nurses and sterile processing professionals and really any healthcare professionals. So it really does embody that interdisciplinary approach. When we look at education, microcredentials, credentialing, continuing education, whatever it may be, when we look at it at the 10,000-foot level, what do you see making the biggest shifts over the next 5 years?
Well, so I was going to mention this and hope that we could return to this topic. So thank you. Um, Here's an important point to remember. Micro credentials are not certifications. They don't put initials after your name. And Lindsay, I think you spoke to this earlier about the nature of micro credentials. They exist at a point in time. So they can help you to learn about microbiology, cross contamination, decon processes for what we know right now. Um, these are not like a college degree, and in some ways that's good because um, sometimes on micro credentials we put expiration dates, and so we acknowledge that the body of knowledge continues to evolve. So for micro credentials, you earn them, you put them on your resume, you note them on your records, but they have to be renewed or replenished. And so you would have to return to the body of knowledge. And so with an expiration date, if you said, this is good for 2 years or 3 years, then at some point in the future, you would have to return and go through the content again in the current body of knowledge. It keeps you current. So you can earn a college degree, an associate's degree, a bachelor's degree, and you don't renew that. For this, micro credentials allow you to develop your own learning plan and stay current in the areas that are relevant to you. And this can be done in real time. I think that's one of the big benefits of micro credentials is you can use them to put together your own continuous professional development plan and keep it current.
Lise, what about you? What do you see happening with the evolution of sterile processing education?
I see that it will move away from just on the job training and move more into these more creative and dynamic educational experiences because we're understanding that there are major skills gaps in the industry and that technicians really want to learn and they want to have these opportunities, but the facilities themselves don't have the resources to be able to fill that skills gap. So by partnering with various industry stakeholders and really um, utilizing the technology and making certain that the education is evidence-based. I think that's another huge piece of this, and making sure that people have um, the the skills to um, not only approach learning from multiple vantage points, um, but also to be able to apply that in a real world setting. So I think those are the key points.
And that application is huge. Something that really differentiates a micro-credential from a general credential is that it has the ability and the opportunity to really hone in on something specific. Credentials, offer a foundation for everything that you need to know. But in terms of taking one of those bits of knowledge and really bringing out the nuances of it and really going deep into, you know, the critical thinking aspects and the implications of that specific topic, microcredentials are the perfect way to do that. And Jim, in terms of the opportunity for Beyond Clean and CCI to collaborate, I think that this is monumental. I think that putting out these microcredentials, and I say microcredentials plural, this cross-contamination one is the first. So 2021 will be the year of the cross-contamination microcredential. But certainly, with a continued effort to put out more into the future as well, and really build out the opportunity to go deep in your learning of the sterile processing space and of the nuances that really build it. So I want to thank you both for all the work that you've put in, Lisa, in building out the educational activities and putting together the educational content, and really for the strategy and the thought process behind engineering a learning opportunity and an education activity that really brings someone's professional development to the next level. Thank you for all your hard work that you put into that. I'm excited for the industry to experience what you've created. So that's really, really exciting. And Jim, your dedication to interdisciplinary education is unmatched. So I want to just take a moment to say a huge, huge, huge thank you to CCI. We are honored to partner with you, and we're excited for what's to come between our two organizations in the future. So thank you both for this discussion today, and I look forward to talking again after the release of the cross-contamination microcredential. To everyone who's tuned in, thank you for spending some time with us on this premiere edition of Talking Dirty. We invite you to seek out microcredential learning and to continue developing yourself as a professional. Learning is so important, and Beyond Clean and CCI are both dedicated to helping you continue learning. Thank you, everyone. Enjoy your day, and we'll see you all soon.